Hello and welcome to the program. I'm your host, Neil Howard, for this Health Supplier segment here on Health Professional Radio. Thank you for joining us. Going to have a conversation this morning with Mr. Chris Byrd, Executive VP at WEX Health. And he's joining us on the program today to discuss the growing trend around health savings accounts, or HSAs, and healthcare benefits. Welcome to the program, Chris. How have you been?
I'm doing well. Thanks for having me, Neil.
Well, tell us about WEX. What is WEX, W-E-X, WEX Health, and what is your role there as Executive VP?
At WEX Health, we help people pay for health care, either their out-of-pocket expenses or their premiums if they've left their employer and they're on a COBRA plan. Mm-hmm. And our platform is used by hundreds of organizations across the country who administer employee benefit plans to over 300,000 employers. And ultimately, the beneficiaries of these plans on our platform number about 25 million Americans. And I am the Chief Operating Officer here.
So what is an HSA, or health savings account, and how does it differ from just putting some money in a shoebox and waiting for that leg to break and going to the doctor?
Well, that's a great question, Neil. And the answer takes a couple of different forms. First and foremost, a health savings account is an account that an individual can open if they have a certain kind of health insurance plan that has a high deductible. And an individual can fund that health savings account either directly out of pocket or through their employer plan by regular payroll deduction, much the same way that they would fund their contributions to a 401k. And that is the most popular method of contributing to these accounts. What makes these different than a shoebox? A couple of things. The first and probably the most powerful is that these accounts are triple tax-free. And what that means is that the money that you put into these accounts is deducted from your taxable income, so it reduces your tax bill. The second is when you use this money down the road for qualified health care expenses, that money is not taxed to you in reimbursement, so your withdrawals from the account are not taxed. And the third is that you can save and invest these funds, so you can keep them in a money market account and earn interest on them, or you can actually invest them in mutual funds, stocks, bonds, and the like, much the same as you would a retirement account. And all of the returns and all of the capital gains and the buildup in the value of those accounts based on your investment returns is also not taxed. So it's triple tax-free, which makes it the most unique plan out there because there isn't another one out there that's triple tax-free. So that's the first benefit. The second benefit, Neil, is the fact that Americans need to budget and they need to save for healthcare expenses. Unexpected healthcare expenses are a big challenge for many Americans. As a matter of fact, medical expenses, particularly the unexpected kind, are the number one cause of bankruptcy in the U.S. And so people need to have a regular budgeting and even a short-term savings tool. And putting some money aside every paycheck is the easiest way for somebody to build that budget discipline and put that money, in essence, in the shoebox, although a better shoebox, so that down the road when they have that expense, they have the peace of mind that that money is going to be there when they need it.
So just to be clear, an HSA is almost better to have than a savings account at the bank as far as the tax breaks that you get. And it's something that we need to have for unexpected health emergencies. It sounds like a win-win-win.
Oh, it absolutely is. It's a terrific tool. And it's a vehicle that people really need to better understand. There are lots of Americans who could set up and fund a health savings account who don't. And those who do could, and based on the data that we have, should be putting more aside in these accounts. Now, we recognize that for many people who are living literally paycheck to paycheck, that's sometimes easier said than done. But little steps along the way, putting an extra $5 in, putting an extra $10 in, putting an extra $15 in each paycheck. And you know the old financial discipline saying is that if you don't see it, you don't spend it. And so payroll deduction is a very, very good way for people to just tighten that belt a little bit more and put that money into the account so that when they need it, it's there.
So what types of restrictions would the IRS put on such an account? I mean, with something that is a triple win, surely there has to be a little bit of a downside.
Well, I hate to sound as though this is too good to be true, but there really aren't a lot of downsides with HSAs. Probably the biggest restriction is that not everybody can have one. So when the government created HSAs back in 2003, they were very careful to say that you can only fund an HSA if you have a certain kind of health insurance. And I think I mentioned this earlier. And that health insurance has to have a minimum deductible. And for 2019, that's $1,350 for an individual plan and $2,700 for a family plan. And many people choose a plan, either through their employers or on the individual market through a state exchange typically, will choose a plan that has a more generous benefit than that, doesn't have that high level of deductible. And so if you have health insurance that doesn't qualify, then you can't fund an HSA. The good news is there are other vehicles, particularly a flexible spending account, which most employers offer. It's not quite as tax efficient. It's tax deductible on the way in and it's tax free on the way out, but you can't invest it. And so the buildup isn't tax free. It sits there. It's really a spending account. But for those who don't have the ability to fund an HSA, then they can choose an FSA, and many do.
Now, this is not a tax advice discussion, so I don't want to imply that I'm asking for such, but I'm at work. I get a great Christmas bonus. Can I put $50,000 in an HSA?
You can't put $50,000 in. We wish you could. For 2019, the maximum amount that somebody can contribute to their health savings account, if they have individual insurance, they can contribute $3,500. Mm-hmm. If they have family insurance coverage, they can contribute $7,000. And in addition, if you are 55 or older, you can make an additional contribution of $1,000, regardless of whether you have individual or family coverage. So there are limits, much the same way that there are limits on 401k contributions. There is some action in Washington, D.C. to try to raise those limits, but right now that's where those limits sit.
Chris, are HSAs able to be set up at any time, or do I have to comply with the open enrollment restrictions every year?
Well, that's the other beauty of these instruments. No, you can set them up at any time. So let's say you enrolled in health insurance for January 1st of 2019, and then in February or even March, you decide, hey, I can open an HSA. I should do that. You can open that HSA at any time.
Chris, thank you so much for joining us. Where can we go online and learn more about WEX Health?
You can go to www.wexhealthinc.com.
Great. Thank you so much. It's been a pleasure. Hoping to talk with you again, Chris.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, on this Health Suppliers segment in conversation with Mr. Chris Byrd, Executive Vice President at WEX Health. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.